As healthcare workers, we proudly embrace the honor to lead as essential patient advocates. We often work long shifts, tending to a multitude of responsibilities. We hold ourselves to extremely demanding expectations and greatly rely on others to help us care for those in need. Despite the amazing rewards of serving as a healthcare worker, we frequently experience heavy emotional and physical burdens. As every day and every case is unique, there are often unparalleled risks that many of us are not prepared for. In fact, during a peak of the coronavirus outbreak between June and September of 2020, Mental Health America surveyed over 1,000 healthcare workers. Of those surveyed, 93% regularly felt stressed and 86% regularly felt anxious. At least 3/4 of workers regularly felt frustration, exhaustion, burnout, and overwhelm. Even prior to these statistics, it's common for some to feel unappreciated, angry, fearful, lonely, powerless, disconnected, and grief. These mental health concerns may lead to both emotional and physical exhaustion, trouble sleeping, and upsetting dreams. Some even begin to question their career path and may feel too fatigued to perform daily functions. Whether you're just beginning to embark on your career or are a seasoned professional, you may encounter daily challenges, uncertainty, and unique sources of stress. We care for patients who experience trauma, tragedy, and threats. So we ourselves may experience mental and emotional distress due to our compassion and empathy for those we care for. Compassion relates to our ability to feel for another person when they're in distress. Empathy is our ability not only to understand, but to become one with another person's distress by feeling as though their distress is our own. Compassion fatigue consists of burnout and secondary trauma with symptoms such as excessive blaming, bottled up emotions, isolation from others, compulsive behaviors, poor self-care, or a reoccurrence of nightmares and flashbacks. By becoming aware of the mental health challenges that we experience and practicing healthy coping strategies, we can better care for ourselves, our patients, and our colleagues. Sometimes we may need to have conversations with our support team and embrace our resources and healthy coping skills. To help us become more aware, we'll next review common mental health concerns that healthcare workers experience. We will then continue our journey as we prepare to channel our distress, build our resilience, and practice healthy coping. By developing our awareness, understanding, and resilience, we can better navigate challenging situations. This will allow us to gain more control over issues that tend to affect our judgment, decisions, relationships, productivity, and overall well-being. We'll see you soon.